Welcome to Biztech's Health and Wellness Show, which is today in partnership with Institut Jantung Negara, the National Heart Institute of Malaysia. Now, on the Health and Wellness Show, we focus on equipping you with the knowledge on health and wellness to help ensure a more productive and healthy life for yourself, your families, and your employees. Now, in conjunction with World Diabetes Day, today the conversation is about the potential of developing diabetes after COVID-19. To bring insights on this topic, we have Professor Dr. Azmi Kamaruddin, consultant endocrinologist at Institut Jantung Negara, the National Heart Institute of Malaysia. Dr. Azmi, welcome to the show.
Thank you.
Now, Prof, before we start, could you please give us a quick introduction about yourself, your training, and your specialty?
Okay. I graduated in medicine about 30 years ago from Melbourne, and then did my postgraduate training and specialty training in Northern General Hospital, Sheffield, UK. After returning back from UK, I practiced with the National University of Malaysia Medical Center, UKM Hospital, and then went on to become Professor of Medicine and Diabetes and Endocrinology. In the past, I have been President of the Malaysian Endocrine and Metabolic Society for 8 years, from 2008 until 2016, and also formerly the President of the ASEAN Federation of Endocrine Societies. Currently, I am elected member of the Malaysian Medical Council, and I'm chairperson of the Fitness to Practice Committee, as well as the disciplinary board of the Malaysian Medical Council. At the moment, I'm practicing as a consultant endocrinologist with Institut Jantung Negara, National Heart Institute, Malaysia.
Now, we are privileged to have such a distinguished doctor. Thank you very much for your service. Now, Professor, let's start by getting down really to the basic. What causes diabetes?
Okay, right. First of all, we need to understand there are two types of diabetes. There are two main types of diabetes. The most common type, which account to up to 99% of diabetes in this country as well as in this region, is what we call as type 2 diabetes. Now, what happened with type 2 diabetes as a result of a strong family history, coupled with with lack of exercise, with not controlling your diet, leading to obesity. Soon individuals develop obesity, weight gain, and with the weight gain, with obesity, their cells become less sensitive to insulin. Insulin is a hormone that's produced by our organ called the pancreas. And this pancreas, what it does is it produces insulin, and this insulin would then drive or push sugars into the cells from the blood. Essentially, every food that we consume, is turned into sugars in the blood. And for the sugars to enter the cells, the tissues, it needs insulin. So as individuals with family history of diabetes, or those who have genetic predisposition to get diabetes, and they gain weight from lack of exercise or from overeating, then as their cells grow bigger, as their fat cells grow bigger, they develop what we call insulin resistant, which means their cells are not sensitive to the insulin anymore. They become less sensitive. You require more and more insulin to push the same amount of glucose into the cell. So eventually, as things get worse, and finally the pancreas becomes overworked, overstimulated, overworked, then it finally starts to fail. And when pancreas fail to produce half of their required insulin level, yeah, then you start to develop diabetes. This is what we call as type 2 diabetes. And in Malaysia, for example, it accounts up to 99% of cases. Now, the other major type of diabetes is what we call as type 1 diabetes.
Okay.
Type 1 diabetes is purely a case of our own immune system, yeah, our own lymphocytes, our own white cell. See, our immune system, I'm sure a lot of us are familiar with immune system by now as a result of COVID, yeah.
Correct.
Yeah, is primarily driven by two components. White cell, yeah, which goes on to destroy viruses, bacteria. At the same time, there are white cells that produce antibodies that bind with these viruses, bacteria. Yeah. So what happened though with type 1 diabetes is that these white cells and these antibodies, yeah, usually as a result of previous viral infection, will now recognize the pancreas as something foreign. Yeah, because of the previous prior infection with viruses. Yeah. So now our white cell, our antibodies, for some reason, as a result of programming problem, begin to recognize the cells in the pancreas as foreign and start to attack the cells that produce insulin in the pancreas. And when that happens, the pancreas fails to produce insulin altogether overnight. And suddenly, patients develop what we call type 1 diabetes, no insulin whatsoever, and blood sugar goes up to dangerously high levels. Yeah, it's not like type 2. Type 2 is a gradual, slow process that occurs over months and years. But with type 1 diabetes, it can occur overnight, over a short period of time. Yeah. So with type 2 diabetes, of course, as you gain weight, as you develop insulin resistance, yeah, as your insulin starts to, as the level starts to fall down, yeah. So of course, treatment would involve exercise, looking at your diet, followed by tablets. If that fails, finally, as the last straw, we put patients on insulin.
Okay.
Whereas those on type 1, from day one itself, yeah, they require insulin. Yeah, they require insulin, especially with each meal, because with as they start to eat, yeah, with each meal, you get increased glucose, and with that increased glucose, you require insulin. So patients with type 1 diabetes, which usually involve children, yeah, children and young adults,
Okay.
yeah, they will require insulin injection from the beginning, from the start of diagnosis, as opposed to the type 2, which can, gradually develop over many months and years. So they can have, they can have us just on 1 or 2 tablets, then keep on increasing the tablets, and finally we add on insulin, perhaps 1 injection per day. Later on, yeah, it can be up to 4 or 5 times per day.
Now, Professor, one of the things that's happened, and interesting that you said that type 1 is only 1%, but interestingly enough, new studies have found out that COVID-19 has basically resulted in many people developing diabetes symptoms for the very first time. Now, is there an association with COVID-19 infection and and something that actually brings out diabetes sooner than otherwise would have been the case? And is there a correlation also with type 1 diabetes?
Right. Okay. Now, remember when I was explaining about the beginning of type 1 diabetes, how I related it to viruses, yeah?
Mm-hmm.
Type 1 diabetes started when our immune system begin, when our immune system, following virus, following a viral infection such as Coxsackie, adenovirus. These are your day-to-day normal upper respiratory tract viruses. Yeah? They're called Coxsackie, Adeno, Echo, yeah, several of them. So following these viruses, yeah, the body begin to identify cells in the pancreas as similar to the viruses and started to attack the pancreas. Now, what we realized though, since the advent of COVID, that the same process is now, is now being triggered by COVID infection. So this is common in the West because in the West, yeah, Brian, unlike in Southeast Asia, especially in Malaysia, in the West, the prevalence of type 1 diabetes is up to 10 times that of Asian region.
Why is that? Why is that, Professor? That's such a big disparity.
Yeah, the disparity has to do with immune system. Yeah, they live in temperate countries. Yeah, they get frequent viral infection in the past. Yeah, so in the West, especially in in Western Europe, in North America, up to 10% of diabetics are actually type 1, as opposed to in Malaysia and Southeast Asia, maybe 1 or 2% only.
Okay.
Yeah. So so as a result of this prevalence or high incidence of type 1 in Caucasian, in Western countries, yeah. So you see a sudden increase in the diagnosis of type 1 diabetes among children in the West. But in Malaysia, for example, in Malaysia, we have not seen a significant increase in the diagnosis of type 1. Although among patients with type 2, yeah, a lot of them, because type 2 in Malaysia constitute up to 20% of the adult population. So of course, that can itself being an independent risk factors for morbidity and mortality with COVID infection. Yeah. So if you look over the last nearly 18 to 20 months now since the advent of COVID, we notice that up to 40 to 50% of our mortality had to do with a history of diabetes.
Gosh, that's a very high number, 40 to 50%.
Yeah.
Now, is that because the COVID-19 impacts the insulin-producing cells in the pancreas?
Primarily is this: patients with diabetes generally have have a compromised immune system.
Okay.
Without COVID, even without COVID, especially those who are not well controlled, they are prone to get infection. Yeah, skin infection, urinary tract infection, chest infection. They are very prone to that. Okay. Yeah, that's even without COVID. What more when you have COVID? Because once you have COVID, yeah, two things are attacking your immune system. The fact that COVID in itself, yeah, suppress your immune system, and on top of that, you already have diabetes with a background, reduction in immune tolerant immune system. Yeah, so you're literally diabetic who got infected with COVID have got two prongs of attack on their immune system. One, by virtue of the fact of them having diabetes. Secondly, by this direct invasion or direct infection by COVID. So that's the reason why they have easily 2 to 3 times, sometimes up to 5 times the mortality rate of those who do not have diabetes. Yeah.
There's also another challenge, Professor, with the fact that some patients are given high dosages of steroids. Okay, and then what happens is because they require oxygen and stuff to fight COVID, but then that impacts you then with a predisposition to developing type 2 diabetes. Can you tell us about that and how do we then overcome that?
Okay, all right. Now, in Malaysia and similarly in countries around Southeast Asia, easily 50%, number one, 50% of our diabetics remain undiagnosed. Yeah, remain undiagnosed. 50% remain undiagnosed. Okay. Remember just now I was saying that close to 20% adults have got type 2 diabetes. Yeah. Yes. Half of that, 10% remain undiagnosed.
Now, is that because we don't have a mechanism for regular checkups?
we have mechanism for regular checkup. It's the individual that do not come forward to be screened, to be tested.
Okay.
Yeah. For example, government servant or some corporate bodies do institute health screening after the age of 40. So with any health screening, you'll definitely pick up diabetes. Yeah. It's just the individual. We have cases whereby individuals who, after health screening were told to have diabetes, did nothing, kept quiet about it until 5 years later they presented with complications. Yeah. So.
Okay.
So let's go back to that, Nick. So 20% have already got diabetes, half of whom remain undiagnosed. Now, on top of that, another 20% have got what we call pre-diabetes. Yeah. So all in all, nearly 40% of our population are at risk of abnormal glucose tolerance.
Wow.
Half being
That's a big
diabetic.
number.
The other half are pre-diabetic. So when they get COVID, when they get COVID, especially when there is a reduction in their oxygen saturation, that's when, of course, they require oxygen replacement. But at the same time, they are put on high-dose steroids. That's very important. The dose of steroids that we use for COVID is tremendous. The dose is 10 milligram dexamethasone. Yeah. Okay. To know how high the dose is, let me tell you, Brian, individuals, we humans, we produce steroids, Steroids are produced to fight infections, steroids are produced to fight stress, steroids are produced to maintain blood pressure, etc., and so on and so forth. The amount of steroids that we produce every day, is just 0.35 milligram dexamethasone. 0.35, and here we are giving 10 milligram dexa, which is what? 30 times? 20 to 30 times the normal dose of steroid in our body. So you can imagine the impact it has not only on our immune system, but if you were to recover from the COVID, the impact that we will have on appetite, on our risk of getting obesity, our risk of getting infection, is that high-dose steroids, although it is essential, important for the treatment of COVID, but it can also lead, especially if it's taken for more than a week, it can also suppress immune system, and you can get what we call secondary infection, secondary opportunistic infection. So that's the thing about it. So what is important though, with such a high-dose steroid being given over more than a week, or sometimes to 2 weeks, and there are cases that are given for 1 whole month, patients who are prone to get diabetic, or those who already have pre-diabetes, easily, once they are discharged, they can, as a result of taking those steroids, they can manifest diabetes, type 2 diabetes, a few days, a few weeks, to even a few months after discharge. So for these patients who especially those who are obese, those who have a strong family history of diabetes, and those who are very long-term dose of steroids, then it is very important for them to embark on a lifestyle intervention, in order to prevent the onset of diabetes. In fact, for those who are very obese, those with a strong family history, there may be even a need though to prevent diabetes by giving medication. There are diabetes medications that are used in previous studies, in previous trials, that are used to prevent diabetes. So
Professor, this is a very this is a problem that is not discussed in the journals or in common material at all. The average person has no idea that this is happening. Is there a holistic way that we can, and the reason why this is so crucial is the fact that we've got so many people who have, at least now, even with vaccinations, mild COVID symptoms, they've recovered. Obviously, they've got heightened risks to diabetes, which nobody has realized. So what do we need to do to help ourselves?
Okay, let's say, once once you develop, once you've got infected by COVID, okay, and Brian, you know very well that up to 80%, as far as 80% of COVID infections are asymptomatic.
Yes.
Meaning that they themselves do not have any symptoms, and there is high likelihood that they themselves do not know they have COVID infection. So for this patient, especially those who have a strong family history, number one, strong family history, meaning that there is a history of diabetes in your first degree relative, yeah, grandmom, parents, aunt, yeah, or siblings. Then and secondly, those who are obese, those who are overweight, those are obese. So they have to, during this pandemic, to be extra careful with their food intake, look after their diet, and despite the MCO, embark on some sort of physical activity within the confines of their house or something. And more importantly, to continue to screen themselves for diabetes. Right, the first case of diabetic in this region was actually from Singapore back in April or May of last year. There was this Singaporean adult who was proven to be who caught COVID infection, but did not require any hospitalization. He was asymptomatic. Yeah, asymptomatic, did not require infection, did not require hospitalization. But very soon, a few weeks after recovery, he began to feel tired, and he began to start to pass urine more frequent, especially at night. And lo and behold, he developed diabetes, and maybe that this is the first reported case of type 2 diabetes following a COVID infection in this region. Yeah, and ever since then, there have been several cases from the West, from India, yeah, from Africa, from Middle East, cases, patients who have been who were not hospitalized at all for COVID, but end up with the diagnosis of diabetes very soon after that.
That's also another symptom where during hospitalization, COVID patients tend to lose weight, but then they have accelerated weight gain post hospitalization. Could you tell us, enlighten us a little bit about that and how we can look after ourselves better?
Right. Okay. So of course, with COVID infection and patient get hospitalized, yeah, there is reduced calorie intake, yeah, reduced energy intake, and they begin to lose loss of weight, yeah, despite on high dose steroids. So now, the moment they are discharged, as you pointed out, yeah, then they recover their appetite, and when they recover their appetite, they quickly regain back the weight. And the fact that they gain back the weight, and there is fluctuation in the weight, yeah, low body weight followed by marked gain in body weight. So you get kind of a stress on the pancreas, yeah. Not only that, when you quickly gain body weight over a short period of time, you develop marked insulin resistance, like what we described before. But at the same time, you are exerting a lot of stress and pressure on your pancreas, and that's the thing that can lead to diabetes. Yeah. So I'm not sure, Brian, you've read about the famous American actor Tom Hanks. That's right.
I see. Okay, Tom Hanks is diabetes.
Now, Tom Hanks is a good case of somebody who developed diabetes, because you know how Tom Hanks, for every movie that he acted, yeah, he would, go on a special diet in order to fit the character of the movie. So, in some instances he had to gain weight, and some instances I remember very well, he had to lose lots of weight in one movie whereby it's like the Robinson Crusoe movie.
That's right. I think it's Castaway or something like that.
Yeah, that's right. It's called Castaway. Yeah. So so he quickly, after Castaway, when because he had to lose lots of weight, and of course, once you lose weight for a certain character, and after that, once the movie shooting is over and you start eating your normal diet and you gain back weight. So very soon after pass away, he developed diabetes. Yeah,
I see.
yeah, he developed, and he blamed it on the fact that, in fact, he blamed it. His doctor discussed with him at length. Few diabetologists discussed it with him, and they came to the conclusion that this fluctuation in weight as a result of trying to fit various characters that he in various movies. So that's the reason why he end up with diabetes. So our body do not deal very well though with marked fluctuation in weight. Yeah.
So, Professor, this is something also that our audience needs to be cognizant of, because the reality is many people, and this is slightly off topic, but still relevant to the issues at hand. Many of us go on crash diets. So you want to lose 5 kilos, 10 kilos, whatever, and then you put it back on. So those swings in weight also contribute to potential diabetes down the track.
Yes. See, what happened is, especially, if you lose weight quickly, and then, see, the problem, Brian, with the rapid weight loss is that it's difficult to sustain.
Yes.
If you lose weight, it's very difficult to sustain because there's so many things that within your body that is working against that. See, when you lose weight quickly, your body, every system in your body, the gut, the cells, all try to push you back to your previous weight.
So they're stressed.
Yeah. So I've given a lecture before, 10 reasons why it is difficult to lose weight scientifically. Yeah. So and because of that, so the body will then push. It's difficult to maintain the weight, and they try to push it up back. And when that happens, this is when insulin resistance sets in, and the pancreas starts to fail. And not only so, they will develop diabetes. Yeah. Another feature, since you brought this up, another feature of rapid weight gain is this. For women, for example, you stop menstruating. Women who lose 10% of their body weight within a space of 3 months, they stop menstruating. Similarly, women who gain weight 10% within the space of 3 months, 10%, they also stop menstruating. And the equivalent thing that happened in men is that your fertility drops. Men at extreme of ages, very obese men, very thin men, have got reduced testosterone level. And along with it, it also affects their fertility. So, fluctuation in weight is not something, is not something that should be encouraged. Though, you shouldn't try to lose weight too quickly, because your body will act against it. It will rebel. Your body will rebel. That's essentially what it is. Which makes your job of maintaining the weight extremely difficult.
Now, Professor Azmi, it's been a fascinating conversation and very, very educational. But before we end the show, would you like to share some final nuggets of advice?
Okay, all right. Audience? Right. Now that more than 95% of us are vaccinated, and of course, with that, we may feel that it is safe, to go back to the old way of social interaction. But it's very important, especially for those of us who have a weight problem, those of us who have a strong family history, be very careful though, because once this pandemic is once we are slowly recovering, there is a high likelihood that due to previous COVID infection, that we might be prone to get diabetes. So for that reason, it is important to always continue to adopt a healthy lifestyle despite all its difficulties. Try to maintain a certain level of physical activity. The recommendation is half an hour of physical activity at least every other day. Calories, look after your calories. Especially try not to indulge in a heavy dinner on a daily basis, especially close to bedtime. And more importantly, make an effort. Say, before this, we used to tell high-risk individuals, high risk of getting diabetes, we used to tell them every 6 months, go and have yourself screened for diabetes.
Okay.
I would imagine in the next 1, 2, 3 years after, while we are in this pandemic and it starts to dwindle down, I would imagine that you would need to do it more often, perhaps every 3 months. Yeah, make sure that, you have an idea what's going on with your blood sugar levels.
Professor Azmi, thank you very much for taking your time to be on the show.
Okay. Yeah, it's my pleasure. Enjoy it.
I'm Brian Fernandez, and we've been speaking to Professor Dr. Azmi Kamaruddin, consultant endocrinologist at the Institut Jantung Negara, the National Heart Institute of Malaysia. I'm Brian Fernandez on Biztech's Health and Wellness Show, which is in partnership with the Institut Jantung Negara, the National Heart Institute of Malaysia, and in conjunction with World Diabetes Day. This video and podcast will be on our social media platforms as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thanks a lot for tuning in.